Hey guys, welcome to Podiatry Practice Mastery. Don here. I want to talk a little bit today about my frustration with nail fungus. And this is something that's pertinent, I think, to everyone. And I was talking to a doctor. A doctor actually asked me a question. We were talking about there's one type of laser that it's a kind of a pay-as-you-go. And we're kind of talking about the differences in lasers and treatment. And I want to kind of lay it out there, and if anyone disagrees with me, please send me an email and let me know. If you have found the world's greatest laser that works, let me know, okay? Because I go to the different sites and I see these beautiful before and after pictures, and it's just not something that I'm seeing. So maybe you know more than I know, but I'll tell you kind of my experience and like to lay it out. So we initially had a Cutera laser, and that was one that we had to get it up to a certain temperature, and it was supposed to be this greatest thing since sliced bread. And we bought it, and it was super expensive. And now we just use it for warts because it works really good for warts. It didn't really work well for nails. I wish it would have. I just didn't see the experience. And I know there's some people that say, oh, you should do it along with Lamisil. But my whole thought is if I'm going to do Lamisil, I'm going to do Lamisil. If I'm going to do laser, I'm going to do laser. I'm not going to, double dip and do both. I just I want to sleep at night. And so I started with that. Now we just use it for warts. And then we came up with I didn't like it as well because it just took a long time for me to do it. And I didn't see the results. If you guys see the results, let me know, okay? And then the other one we did was the Lunula, which is the new one you pay as you go. And we rented this one. I think you pay $50 every time you use it, and I think we charge $150 per foot, so we make $100. The reason I rented it is because I didn't want to buy another $60,000 laser because I just didn't believe it would work, and I'm glad I didn't buy it. But I'm getting tons of patients that get referred from the Cutera site, but most of them I talk out of doing the laser just because I think the way I kind of explain it is the laser, as I think about 60% effective, that's what I say, and the oral is about 80%. If you guys have a different way of explaining it, or if you have great results, I think a lot of it certainly is patient selection. So kind of my go-to is I take a nail sample to verify. I don't call that nail a sample a biopsy because it's not, in my opinion. I take a nail sample, I send it off, I get the results in a couple weeks, and then my staff calls them and they go over the options. The topical, which I don't think any of them really work well, and so I don't give them. We have some if they want to buy the formula. I don't know what number we're up to now, but Formula 3 or Formula 10 or 25. And the only reason I do that is because it has a money-back guarantee. Once again, maybe it might work on a superficial or one edge of a nail, but I don't think it works if they're totally involved in super thick. And then they'll go over laser or oral. And most of my patients I'm putting on oral. If you guys are doing a lot of laser and you're getting great results, I would like to know. So I'd like to interview you. I'd like to talk about it, get your experience. I've watched some of the webinars, and that just hasn't been my experience. So if other people have had great experience, I would love to, because then I could offer it with more confidence. And maybe it's my protocol with the Lunula. I tend to do 4 treatments once a week, and then I might do once a month for another 3 or 4 months. And so it tends to be quite a bit. Maybe it would be cheaper if I bought the machine, because if I bought the machine, I think it would be $10 every time I turned it on, and then I used it on a foot, and so I could do, charge less and maybe do more treatments. So that's kind of my take. This is going out to, there was a doctor that asked me about kind of my thoughts on it. So I think I'm just jealous I didn't think of this whole laser that you pay as you go. I think everyone is doing this whole pay for like a subscription, I guess you would call it, every time you turn it on. I know Swift has something similar. The benefit to that, in my opinion, let's say paying the $10 for the laser thing, or even if you do own it, or paying for the Swift tips. The benefit is that they have all this extra money that they can put back into marketing for your practice, which I think is a great way of doing it. So what are those things that that can do advertising for you to get patients in your door. I know we get a lot of patients, not a lot, but patients frequently say they came in from the CaryFlex website, they came in from the Lunula website, they came in from these other websites, and they're sending patients to our office, which is a good benefit. And so that kind of is something that's a plus. Unfortunately, a lot of them I'm not doing it just because I don't find it at the same level as the Lamisil. Anyway, that's my rant on fungus today, and I'd love to know what you guys think. Send me an email at don@podiatrypracticemastery.com, and I'd love to hear if you want to be interviewed and say, hey Don, this is great. I use it every single day, and I think it's better than Lamisil. Let me know. Okay, thanks guys.